Now, for our next discussion is more of like we're trying to look at statistics. So this is the epidemiology of malaria in children. So I'm looking at it worldwide. How has this actually affected children worldwide? Okay. So I have a map here which is basically trying to show the density, but basically the density map should actually give you an idea of which countries are actually much more affected. You understand? But it's when I upload the videos you guys will see it. So just a summary, malaria is actually one of the leading causes of illness and deaths in children under the age of 5, okay, especially sub-Saharan Africa. Okay, so what's the global burden? It's a major public health problem, okay, and it kills a child every minute. Just know that every minute a child dies of malaria, if not in Africa, worldwide. So imagine the heartbreaks that malaria is causing to families. Okay, so in 2023, malaria caused about 597,000 deaths globally, and 76% of those deaths were children under 5 years. So regional distribution, sub-Saharan Africa carries the heaviest burden, okay, accounts for about 95% of malaria cases worldwide. So countries having the highest child deaths due to malaria include Nigeria, Democratic Republic of Congo, Uganda, Mozambique. Okay, I know Nigeria is topping there because of the population, you know. If not, Nigeria has a better healthcare system than the other countries, you know. So transmission is highest in West and Central Africa, where the climate conditions is very favorable for mosquitoes. Okay. So age-specific vulnerabilities, you should note this, that children that are under 5 years are mostly, affected because what? Their immune system is weak. Okay. So infants and toddlers are particularly vulnerable to severe anemia. Older children may develop partial immunity but remain at the risk of recurrent infections. So you can also have asymptomatic cases where the person is having malaria and for a very long time you are not picking up all those fever and the rest till the malaria becomes a complication. So there's a resurgence of malaria because of drug resistance, insecticide resistance, and health system disruption. Personally, I see some mosquitoes, the way they move have changed. Before, I know that a mosquito will be moving like this, I'll kill it. But some, they have developed their bodies like planes. The way they enter the air, they just disappear from your eye. So these things are actually adapting to us, But because of the vaccines have come in, and let's use the power of sanitation and cleanliness to also drive them out of our environment.